Well, this is an ultrasound study of a primary gravida referred to rule out any fetal anomaly. The presentation is beige, and what we see is that the lower segment of the uterus is significantly dilated. This is the lower segment of the uterus. This is the uterus lower segment. This is the urinary bladder, and what we see is that you will see that the foot of the fetus is, this is the these are the leg bones, and this is the foot of the fetus that is being seen in the dilated segment. Now this is the dilated lower segment of the uterus. Normally you do not see this much dilation of the lower uterine segment. Now the problem is that if such thing happens, there is usually a chance of any prolapse of the umbilical cord in this region, or a foot being pressed in this location. And this is the urinary bladder. This is the foot of the fetus, and when the contractions occur, it can lead to different deformities of the foot. And these are the leg bones. This is the knee joint, and this is the lower leg, and the degree of dilation of the lower segment is in front of you. So this is a condition in which the mishaps that can occur are usually that either a foot becomes talipes, dural talipes, or any other deformation of the foot can occur at the ankle region. Whereas you can see that this is the tibia and fibula in front of you, these two bones. This is the knee joint, whereas the cervix, if I talk about the cervix is measuring approximately 3.5 centimeter, and it is closed. There is no dilation of the cervical canal. However, what is dilated is the lower segment of the uterus. Now this is now you see two things. This is the urinary bladder, and this is the dilated lower segment of the uterus, whereas upper in the anterior upper region we do not see this much of the amniotic fluid. This is the fetal heart, and the lungs, the liver. This is the liver now in front of you. These are the so in this particular case, now you see that this segment of the umbilical cord is, and now this is the umbilical cord, and this is the lower segment of the uterus, and the umbilical cord is entering into it. Now these are the foot fingers. Count 1, 2, 3, 4, and 5. This is the thumb. So two areas are seen within this dilated. This is the dilated lower segment of the uterus. This is the placenta. Placenta is anterior wall. This is the urinary bladder. This area is representative of the urinary bladder. Now these are the foot fingers. The fingers are okay. The umbilical cord is also entering into this dilated lower segment of the uterus, and the lower segment is dilated up to approximately 5.4 centimeter, which is really very unusual, rare to see. And in such cases, two kinds of anomaly, the prolapse of the umbilicus and deformity of the lower limb extremities can occur, especially the foot. angle of the foot by the pressure. Now this is the second foot, this one. This is also pressing upon the lower uterine segment wall. Here you can see this is the foot. This is the another one, second one, 2 foots you can see, one and the second one. Now this one is pressing and can lead to deformity of the foot that is, there is a possibility of that. Here you see this is the foot again pressing upon the lower uterine segment with closed cervix. The cervical canal is closed. This is the cervix, the urinary bladder, the cervix, the amniotic fluid, and the lower. These are the calf muscles. These are calf muscles. This is the foot, and this is pressing the wall of the lower segment of the dilated uterus, and there is chance of some fetal deformity in this particular case. Thank you very much.